Hello, everyone. So today I'm going to be talking a little bit about telemedicine, and I'm Alexandra Curumi. I think telemedicine is really picking up in the society that we live in today, and I think it's super important for us just to learn more about it and go into depth about kind of what it is, especially the pros and the cons of it. We really need to focus on that in order for this to either work or not work. So, to begin off, I just wanted to talk about what telemedicine is. And the first definition that I got was just straight from Webster Dictionary. Telemedicine is the remote diagnosis and treatment of patients by means of telecommunications technology. When we talked about telemedicine in class, we actually spoke a little bit and just in, common terms, this is when anyone of any age can get medical advice through a computer or phone rather than having to go to a doctor's office. This sounds great, this is great, but of course there are benefits and there are cons of every new medical engineering that we find every day. So some benefits of telemedicine. Elderly people that use telemedicine do not have to leave their house. This is awesome news in retrospect that some elderly people physically cannot leave their homes. A lot of people will have reduced costs when visiting over online. When you go to a doctor's office, a lot of the times they use certain equipment or they have you do a certain test that can actually increase your bill. And it is also less time consuming. So when you think about it, you have to leave your home, most likely get into a car, drive traffic, whatever, add time there. And then when you get to the doctor's office, you have to wait in the doctor's office. You're going to wait there for probably a good amount of time. I don't know about you, but I've personally never been to a doctor's office where I don't sit down for more than 10 minutes to wait for a doctor. So in this case, you literally will just pull up your laptop, pull up your phone, and you just talk to your doctor one-on-one about whatever case you may be having. So I pulled this next quote, straight from health.usnews.com. And this is actually stated from Jessica Harper. She says, telemedicine can also reduce travel expenses, according to Paula Guy, Chief Executive Officer for the Georgia Partnership for Telehealth. It can reduce travel expenses, especially for the elderly people when they rely on other means of transportation if they can't drive. So if they have to use an ambutrans or if they have to use a cab or a bus or anything, those are all travel expenses that can seriously add up, especially if they have to go to the doctors often. I pulled this quick stats from Modern Health, and it just kind of shows what's going on. 76% of organizations surveyed that currently offer or are planning to offer telemedicine services. So that's a pretty big percentage of organizations that want to offer or are even in the process of offering telemedicine services. So we can see how this is really taking off. 29% of organizations that have seen a more than 20% cost savings from telemedicine. So the next quote, just to end the kind of benefits of telemedicine, I pulled straight from eVisit. There was no specific author for eVisit. It's just kind of like an organizational website to inform. It says, engaging your patients through telemedicine can help them maintain appointments and care schedules. Increased engagement initiatives can also curb obesity rates and tobacco use by helping you to encourage your patients' healthy lifestyle choices. So if we were to have a one-on-one conversation over the internet, that means that I, as a medical professional or a healthcare provider, can check in on you more frequently to make sure that you are taking care of yourself, that you're in healthy terms. And I can also do a daily checkup, like, hey, what did you eat today to curb that obesity rate? And how many cigarettes did you smoke today? You're doing great. Simple signs of encouragement really help one. But of course, there are always cons. So some cons is technical training and technology troubleshooting. So this means that you have to get an IT team to teach the medical professional how to use telemedicine and how to properly inform their patient on how to take care of themselves at home. Um, this also costs a lot of money to get IT training and everything. And you're going to also have to train the elderly on how to use, I'm not sure, a computer, let's say, or if they do know how to use a computer, you're going to have to reteach them everything on how to even pull up this new doctor's appointment, which is a complete new learning experience for them. A second one would be lack of human communication, and the doctor-patient experience is kind of deteriorating. I pulled up this first picture because you see when they meet one-on-one, if a doctor asks a patient something and they kind of feel ashamed about that question, or they're not that confident in that question or something, that gives the doctor a social cue on like, okay, let's see how we can fix this problem, maybe anything. And I think that's really important, especially human communication, one-on-one interaction, these verbal cues and eye contact, and they're so important. A doctor can easily see when you walk through the door what's going on. Hey, you look like this. Let's talk about this. It's just a lot easier to diagnose in person rather than over the internet. The third point is that it could eliminate jobs, because if you only need one medical professional per 20 people over the internet, then you're really taking away from other professions in the healthcare field. I pulled this quote straight from vitana.org, and it's quoted by Crystal Lombardo. And it says, in the field of home health, a nurse might see about 7 patients per day. Through telemedicine, that can be multiplied by a factor of 5, which means 4 nursing jobs would be possibly eliminated. End quote. This is pretty serious numbers, considering that there are hospitals and healthcare places around this country, at least. That is so many. This 4 nursing jobs would have to be multiplied by all of those institutes that have nursing jobs and telemedicine. Those are a lot of jobs that can be eliminated from tele. I just kind of wanted to put my viewpoint on things. I think it's a great idea, and things can go very well if people can't leave their homes, or if you just have a simple question and you don't want to have to trek to the doctor's office. I think that this is great. I think that this would be better geared for the younger population, because we're already so tech savvy and we know what's going on. We can really just do it quickly and efficiently. I'm also worried, though, about the fact of human communication in the long run. If we rely solely on the internet and telemedicine, is this really going to deteriorate overall communication in the long run? Like, are we just going to have to rely on computers and robots and electronics in order to just have a conversation with someone? And also, the last point is this going to have to be another task of caregivers to teach them how to use telemedicine on top of it. Most likely, these caregivers are going to have to sit with them during these online appointments, just as if they would sit with them in the doctor's office. So that's my viewpoint. That's why we're excited. Overall, I think it's extremely important for us to remember that telemedicine is growing and that it is so important, and we really need to strap down. If we want this to work, we need to get rid of all these cons, and we need to make it the best experience possible for everyone using it. Thank you.